Hi everyone, welcome to my channel. I still remain Wisdom Akbar. In today's episode, we'll be talking about a disease condition that's actually an epidemic in some quarters, an endemic in some areas. Epidemic in the sense that it's an outbreak, endemic in the sense that there are series of isolated cases from time to time within that very locality. So the disease condition in question happens to be cholera. And if you reside around the western part of Africa, to be more precise, the western part of Nigeria, you may have heard the rumor of this very disease condition. So cholera is simply an acute diarrhea infection that's caused by injection of contaminated food or water. So it can also be defined as a disease condition that's caused by bacterium vibrio cholerae, and it's a bacterial infection. It is due to the consumption of food or water that is contaminated by this very bacteria known as bacterium vibrio cholerae. And cholera happens to be a major threat to public health. According to WHO, there are about estimated number of 3 million cases each year as at 2022, and there are also about 21 to 140,000 deaths each year resulting from cholera. This disease condition, if not attended to, might result in loss of life. It is because of its high morbidity and mortality rate.
So, what are the causes of cholera? The major cause of cholera centers around hygiene, which ranges from how food and food items are being prepared, handled, and stored. So, where individuals do not get access to potable water, there's high tendency for the spread of cholera, as well as where food items are not safe in a clean environment. There's possibility for individuals around this very setting to come down with cholera. And this extends to food handlers as well as food vendors, where they are not well screened, especially in major settings where they employ the services of food vendors. They may predispose individuals to cholera due to the possibility of them contacting this very bacterial infection. Hence, the need for screening. Other factors include environmental factors such as flooding. Where there is flooding, there might be possibility for individuals to be internally displaced. Hence, there might not be possibility for them to get potable water. Also, insecurities such as war and communal clashes may also bring the possibilities of individuals contacting this very infection due to the fact that they are internally displaced and they are refugees in settings where they can't have access to potable water. Hence, settings also where there is poor healthcare facility or insufficient healthcare facilities might also increase the fatality rate. So, if you are found in places where you can't get immediate access for help, the number of persons who may die from this condition will be very high. So, having said this, it will take us now to the signs and symptoms of cholera. What are the signs and symptoms? The major signs and symptoms of cholera include diarrhea, dehydration, as well as vomiting.
It will interest you to know that the signs and symptoms ranges from nil to mild signs and symptoms. So about 20% of individuals are estimated for not coming down with any signs and symptoms, although there may still be high fatality rate. This is because of the dehydration as well as the diarrhea factor that cholera presents with. For the aspect of diarrhea, one, they will present with sunken eyes, they will present with dry lips, they will present with poor skin turgor. Another factor to consider in the aspect of the diarrhea happens to be that there's frequency in passage of loose stool. So how do you diagnose an individual with cholera? When you see a diarrhea that is not going and has presented with more than 3 or more times of watery or loose stool, then you will know that this individual is already presenting with cholera. And the feces may be watery or rice color in appearance, as well as you see this individual constantly vomiting. And because of the dehydration, you see this individual will come out down with sunken eyes, you see the individual come down with poor skin to go, you see the individual very weak, tired, dizzy, and presenting with headache. Most persons present with muscle cramps, which is as a result of high loss of fluid. So when you see this happens within the time frame of 2 hours to 24 hours in most cases, know that it is actually cholera. And that takes us to the management of cholera. The management of cholera anchors on three major factors, which centers around the life cycle of this very bacterium, and finally the aspect of dehydration as well as the diarrhea aspect. This very aspect, the focus are driven towards them, then cholera will be remediable. So let's start from the aspect of hygiene. To prevent cholera, food items must be properly washed, they must be adequately cooked or cured. They must also be handled and stored in a safe and clean environment. If this is actually put in place, there will be high reduction. For those who have already come down with this very disease condition, your hygiene must be a major priority in the aspect of water handling, or food items. Now, this boils down to, for the aspect of water, boiled water, chemically treated water, bottled water are highly recommended for this very individual. So, reduce the rate of using other domestic waters that have not been chemically prepared. It's not bottled water and it is also not boiled. It will rather aggravate the condition. For the aspect of food, during preparation or after preparation of this very food or handling of this very food, there must be regular hand washing. This is to reduce the concentration of this very bacteria or its spread. Now, for the aspect of the diarrhea as well as the dehydration, the major concentration centers around rehydration of this very individual. Rehydration in the sense that you are trying to replace the fluid that was lost. For those who are far away from medical or hospital facility, start with available resources such as ORS, so you can prepare salt sugar solution. You can also, for those who have soft drink accessible to them, soft drinks such as Sprite, 7 Up will be very useful. This is to replace the electrolyte that was lost. Drinking of water as at that moment may not be recommended depending on the state of that individual, because it might further stimulate vomiting. So rather, it will be recommended that ORS, which is the salt sugar solution, would be preferable for this very individual than just plain water. Then, where there is need for sips of water, boiled water, chemically treated water, as well as bottled water is advisable. Then, for those who are already in the medical facility, IV fluids or infusion will be very, very recommended to keep this individual hydrated. For those who are already stooling, although may not be the first line of action, which happens to be the medications. So for the medications that are recommended, both around antibiotics, because cholera is caused by a bacterial infection. As earlier said, Bacterium vibrio cholerae is the factor responsible for this very condition. So antibiotics can actually be helpful, but not the first line of action in emergency conditions. Also, areas that have access to cholera vaccine, it will be highly recommended for them to make use of it or to get themselves vaccinated. Now, the question boils down to, when should I seek medical attention? When you notice your diarrhea is not going, if your normal time of stooling in a day is actually once, or in a week is thrice, then you notice that you are already passing stool for more than 3 times in that very day, it calls for immediate attention. And when you notice this stooling is not going, then you know that cholera is on the way, especially if the color is whitish or rice color, then you know that the condition is already on your door. You need to seek immediate medical attention. When you notice alongside the diarrhea there is vomiting, an increasing and non-stop kind of vomiting, then you need to seek for medical attention. To conclude, I would like to end with this very note that one, cholera is an epidemic in the sense that it has high morbidity and mortality rate. So it must be given immediate attention. Two, if you notice individual, you have relative that already, or you have relative that already come down with this condition, please notify other persons. Then there should be harm reduction in the sense that the number of persons that have contact to this individual should be reduced because they might get themselves contaminated due to the contact to the fecal materials of this individual or fluid content or fluid properties that contains this very bacterium. Now, the next factor to note is that hygiene has a major role to play in cholera prevention or treatment. So, as much as possible, ensure that if you are in the environment where this condition is thriving or there is an epidemic, please, as much as possible, ensure that boiled water is not played down on, bottled water is not played down on, as well as chemically prepared water is not played down on. Next factor to consider, or next thing you need to know about cholera is that it is preventable. It is also treatable. So don't get panicking. Don't get extremely anxious about it. All you need to do is to seek immediate medical attention. For those who may be far from healthcare settings, as earlier said, please, rehydration is a major factor to consider in management of cholera. So if you have salt and sugar, you may not necessarily have the sachet ORS preparation. Please, as much as possible, try to prepare it on time and start taking sips while trying to locate the nearest medical facility. I know you must have learned something today. Thank you so much. See you on my next episode.